Okay. And what are some, I guess, signs that a person may be dealing with a foot injury, and you suggest them to come in and see a specialist such as yourself?
Yeah, the classic sign is pain after getting out of bed in the morning. And so
Mm,
that is a classic sign of plantar fasciitis and sometimes can also be associated with Achilles tendonitis. But I oftentimes ask my patients, well, when you first get out of bed in the morning, what does it feel like? And for those patients with plantar fasciitis, they immediately know, oh no, that's a horrible time of the day for me. It takes me about 5 or 6 steps before I can get going, and those first couple steps feel like someone stabbing me with a knife, or different ways that patients might describe that.
Hello, my name is Devin Haskins, and you're listening to the RVA Running Man podcast, a show discussing topics related to recreational running and fitness. In this episode, I speak with Dr. Jemaar Graham of 360 Orthopedics. In our conversation, we discuss foot care tips, common causes of sports-related foot injuries, ways to prevent them, and best practices when choosing footwear. Today, my guest is Dr. Jemaar Graham, DPM. He's a DPM, foot and ankle surgeon in Sarasota, Florida, and has been in his practice for over 7 years. He graduated from Kent State University College of Podiatric Medicine in 2014, and then completed a 3-year reconstructive rear foot and ankle surgical residency at Central Alabama VA Hospital. He currently works with 360 Orthopedics, I can't pronounce things today, an orthopedic group serving the area for over 40 years. Dr. Graham, welcome to the show today.
Thanks for having me.
Great, great. And I'm glad I'm having you on. Um, in this episode, I wanted to discuss um, foot care tips and some best practices for athletes and runners. And I think having someone on such as yourself, expert as yourself, is perfect for my listeners. So first question, how did you get into wanting to be a podiatrist?
So it started at a pretty early age in elementary school. My
Mm,
mother went to a podiatrist, and they showed me around the office. And my mother tells me that after that, I came back and told her that that's what I wanted to be when I grew up.
wow.
So from elementary to middle school, I was shadowing podiatrists, just kind of seeing what the profession was like. And I've always just had more interest in the foot and ankle than the rest of the body. Something very fascinating about the mechanics of the foot and ankle, the number of bones and joints that are there, and how we rely on our foot through to do all the things that we do.
Wow.
Fast forward a couple years in life, my grandfather was actually a type 2 diabetic and ended
Mm,
up having to have below knee amputations from complications of wound care. And so he ended up losing his life shortly thereafter
wow.
from those complications. And so that just added extra emphasis on the career path that I chose, and being able to provide quality care because quickly learned that saving limbs is actually saving lives. People kind of downplay the importance of their feet oftentimes until things become pretty severe. But multiple studies have shown that when people have a wound, when they develop an ulcer, when they get an amputation, that usually they live less than 5 years after that. And so that's one of my main motivations to continue in podiatry, to educate people and to bring awareness.
What do you think is the most misunderstood aspect of what you do as a podiatrist?
A lot of patients will come in with kind of, I'm sure jokingly, but kind of say things like, oh, you must have a foot fetish, or, you must, really like feet. And I laughingly tell them that if I had a foot fetish, this would not be the profession to choose,
All right.
because this is not where you're seeing glamorous feet. This is where you're seeing feet that have oftentimes been neglected or have deformities or, have issues that they are not your average foot.
Mm,
The other thing that's probably a misconception is that patients just kind of take it for granted that their feet hurt. There's this assumption that, well, yeah, of course my feet hurt. I've, been standing all day, or I've been working, or, whatever, and oftentimes put off problems with their feet because they assume that it's normal to have foot pain. And, it's simply not. If you had a headache that lasted for 4 or 5 days, or, your shoulder was having excruciating pain for 4 or 5 days, people would tend to take that a little more seriously and are more inclined to get seen. But the foot is no different, and so oftentimes I'm treating patients after they've kind of put things off for longer than they otherwise would have. And then
Wow.
that can sometimes be a challenge to help them get back on the road to recovery.
Okay. And as it pertains to, I guess, workouts, what is the most common workout or running related in issues or injuries you see or treat as a podiatrist?
So, plantar fasciitis is by far the most common foot and ankle pain type of issue that I treat. And
Mm,
plantar fasciitis is very common across the United States. Some estimates say that at least 50% of the population has had plantar fasciitis at some point in their lives
mm,
because of the surfaces that we walk on, because of the type of shoes that we use. And so I spend a lot of time educating patients on understanding plantar fasciitis, the way that they can help themselves with stretching exercises and the type of shoes that they wear, and then just being mindful of which activities that they may be doing that might make plantar fasciitis worse and
mm.
ways to avoid it.
Does I guess age, weight, um, race play a factor into who gets any other type of foot or chronic foot injury?
There can be a lot of overlap from the race component, not necessarily a direct correlation with race per se, but more so genetics. And we know that parents who have a flat foot tend to pass that on to their children and grandchildren. When
Mm,
it comes to weight, of course, the foot being at the bottom of the body experiences the force of body weight more so than any other part of the body. So gravity takes its toll, no matter what, and so losing weight will oftentimes help with both plantar fasciitis and with other foot and ankle pains. And
mm,
so there can often be an overlap between all those factors. And unfortunately, the catch 22 oftentimes is that we can't change our genetics. What we
yeah.
have is what we have.
Yep.
Our body weight can be changed, but oftentimes patients are limited by the physical activity they want to do because of their
Mhm.
foot pain. And so they might have that desire to get out there and do more, walk more, and exercise, but they're limited. And so helping patients break that cycle to be able to lose the weight, be more active, enjoy, their quality of life. That's really the goal.
Okay. Okay. I guess as it pertains to footwear, could that make a difference? To a person that may be suffering from some chronic foot pain.
Yes, yep. And big picture, fortunately, now in 2024, there are more foot and shoe type options than was available, say, 20 or 30 years ago.
Right.
The general public has become much more aware of the fact that not all good shoes are good shoes for everyone. And so the difference between a maximalist shoe that has a large midsole and a lot of thickness and padding and cushioning
Mm,
versus another shoe that's more minimal that might have essentially 0 to 2 millimeters of material underneath the foot can work for some patients and not for others. And
right.
so there's a kind of a sliding scale on places for patients to find good information about shoes and about footwear.
Mm,
There are some brands and some companies that have stores and outlet malls and other places where patients can get good information about how to make an informed decision based on their foot type. But unfortunately, there are also a lot of places that are kind of capitalizing on the fact that people who have foot pain are desperate for answers
yeah.
and can easily be misled into purchasing things that are simply not necessary, are not what they're marketed to be. Oftentimes, patients will come in saying, "Oh, I got these custom orthotics
Right.
from a store." And it's like, well, how custom was it? If the person who sold them to you went into the back and pulled them out, from a box,
Yeah.
that's not custom. If they just, had you stand on a pressure sensitive pad and you saw some colors light up on a screen, and this person tells you, "Oh, this is what you need because this turned red," or whatever, that's
Hmm.
not custom. But unfortunately, it's a very lucrative uh, area to be in, and in America, capitalist is the way it is, and so it's a fine line between patients who have done the right research and are able to come in already somewhat informed about the foot type that they have and what they need and what their problem is, versus patients who have unfortunately been misled and oftentimes have to go back to places trying to get their money back so that we can redirect them.
And it's funny you say that because, and I'm guilty of it. There are shoe stores out there that they specialize in things like that, where you go and you put your foot on a pressure pad, and you do see the colors, and that sells you. I guess
Mhm.
that gives me cause for this question: what resources, or is there a strategic or proper method a person should take to find what may be good for them, for our shoe wise? Is there something that you'll suggest?
So the shortest answer is seeing a specialist, because unfortunately, the footprint or kind of the pressure distribution of your foot does not
Hmm.
tell the full story. And so I often ask those patients that might have gone to a place like that, well, did they actually examine your foot? Did they, do any range of motion assessment? Did they watch you walk? And even unfortunately, walking on a treadmill, as
Mm.
convenient as that is, biomechanically is not accurate. And so, in all of our medical journals and medical literature that we study and the things that we had to learn in podiatry school, we learned that watching a person walk on a treadmill is not the same as how they walk in real life.
Mm.
In real life, you are required to push off as you move forward. On a treadmill, that obstacle is completely eliminated. And so, there's a lot that gets lost when patients seek a kind of quick fix. So it's good to just relatively be aware of the fact you have a high arch versus a low arch. Those things can kind of impact the shoes that you choose and things like that. But ultimately, going in and seeing a podiatrist, seeing a foot and ankle surgeon, someone who is trained on that to be able to actually examine your foot, find out where your source of pain is, and then be able to make a recommendation is the best route to go.
I guess an offshoot of we're talking about minimalist and maximalist shoes. There was also, still is, a movement of barefoot running. Is that something that you feel is harmful, or can have long term harmful impacts for a person's foot health?
Yeah, so the barefoot running movement was fascinating and informative, and for the runners who really got into it and went and read the book Born to Run and really
Mm.
understood, where that movement came from. It started on a group of people that were roughly in non-concrete, non-hard surfaces. They were indigenous people that were on, sand and grass and things like that. And so that environment lends itself to being barefoot versus our concrete asphalt surfaces that the majority of Americans find themselves running on. And so there was a kind of backlash that somewhat happened after the barefoot running movement, where a lot of patients were suffering from stress fractures in their foot, because they went barefoot running on concrete, or they went barefoot running in other hard surfaces. And so I think the value is being aware that there are certain environments and areas where that can be beneficial.
Mm.
I do agree with this awareness and kind of push on strengthening our feet, because when we only walk on concrete, when we only have shoes that are overly supportive, it can cause your foot to be weak. And
Mm.
so there's definitely value in looking up exercises to strengthen the muscles of your feet and being more aware of that component. But overwhelmingly, most patients in America are better served with some form of a supportive shoe, some shoe that has a moderate degree of cushioning, so that the heel to toe type of running that most Americans perform can be more safely done without the risk of those other complications that can come from barefoot running.
Okay. And you talked about surfaces. Is there a preferred surface for a person that may be struggling, or dealing with any type of foot injury or foot pain?
Yeah, ideally, rubberized track surfaces are great. They are literally, calibrated to the type of force that a runner expends with heel strike to toe.
Mm.
Not everyone has access to a rubberized track, depending on, where you may live in local universities or high schools or whatever. Short of that, running on a sidewalk or on a grass type surface is the next best thing. The tricky thing with grass surfaces, of course, is that they may be uneven. And so,
Mm.
unless it's somewhere that you're very familiar with and every little dip and divot that might be in the grass, that sometimes can increase the risk of ankle sprains and other injuries of that nature. But if it's a sidewalk or a concrete surface that is uniform and safe and you're wearing the appropriate type of shoes, that's usually the safest route for most people.
Is there any type of exercise that you suggest for a person to strengthen their foot or ankle to help? I know you can't be 100% um, uh, preventive against injury that can happen in any case, but are there any type of exercises that you suggest for a person to do to strengthen the foot?
Yeah, so patients who are dealing with heel pain, most of them will benefit from taking a frozen can or a frozen water bottle and putting that on the floor, massaging the bottom of their heel with that. Oftentimes, patients come in with a recommendation to buy expensive devices that they've seen online that have little knobs and all types of, fancy, over-engineered type of things to do that same thing.
Hmm.
But I tell patients that that's simply not necessary. A tennis ball is too small, in my opinion, and tends to act more like a knot, a digging type of sensation in the bottom of the heel. So I don't recommend that. The benefit of the frozen can is that it's usually wider than the width of your foot. So that makes a very even distribution of force that you're not accidentally putting too much pressure or too little pressure. Because with a frozen can or a frozen water bottle, essentially push too hard, then it'll break. And so
Hmm.
by itself, there's a little bit of calibration that's involved in that, that just by doing that gently to decrease inflammation in the muscles and the plantar fascia and to therapeutically massage that area to help things feel better. Another
Okay.
one is using a towel stretch. And so simply putting a towel on the floor, sitting down, and then using your toes to grasp the towel. Most people think that that shouldn't be very demanding, but they find that after doing that for, say, a minute to 2 minutes, they start to feel the pull and the stretch of the small muscles on the bottom of the foot. And
Hmm.
those are the same muscles that oftentimes become atrophied from using orthotics excessively or using shoes that are overly thick because those muscles don't have to work as hard when we
Ah.
have a moderate amount of support to the bottom of the foot. So there's kind of a balancing act that has to happen. So it's good to wear the supportive shoes and all that, but doing these stretches gives the foot a chance to kind of build up on those muscles that otherwise aren't being as demanded as they would be if you were walking on soft surfaces or walking barefoot.
So it sounds like just listening to that, shoes can also, if you're not doing strengthening any type of strength training of your foot, they can hinder us in a way as far as foot strength. Is that correct?
Indeed, yeah, yeah. And here in Florida, oftentimes people might travel from out of state or somewhere, and then the first thing they do is go to the beach.
Hmm.
And, as they're walking on the beach, people quickly find walking on the beach is a very demanding activity for your feet.
Hmm.
The stability that we get from walking on concrete and that feedback is gone. And so being on the beach, it causes the feet muscles to work in a different way to stabilize the foot, to keep the balance in the foot in a way that most people, don't have to do on a day-to-day basis. And so even the act of walking on the beach, even without running or doing anything necessarily strenuous, can be
Hmm.
considered a form of exercise to strengthen those muscles and kind of see where you are on that kind of assessment.
Is going a step further. What pre and post workout routine should a person, runner or athlete adopt in order to make sure that they're keeping up with their foot care?
Yeah, so the literature is a little bit divided on the benefits versus non-benefits of stretching before activity. There are some studies that suggest that stretching before a sporting event or activity can cause the muscle to lose some of its strength because muscles work by contracting. And so if you've overly stretched, then there's some loss to that. I more so take the approach that stretching gently, nothing too excessive before an activity is helpful. So using a towel around the ball of your foot, stretching out your leg so that your knee is extended, and then
Mm,
pulling back to feel a stretch across the Achilles tendon and across the calf muscle. as well as across the plantar fascia is helpful for most people because in the ways that we walk and in the sports that we play, whether it's tennis, pickleball, basketball, soccer, whatever, the Achilles tendon and the gastroc that connects to the Achilles tendon are one of the largest deforming forces in the
Wow.
ways that we experience pain and experience problems. So by gently stretching that area of your foot and your ankle before you do most sports, before you start running, overall that should provide a benefit and allow less risk of injury and less pain after the activity is done.
Okay. And what are some, I guess, signs that a person may be dealing with a foot injury, and you suggest them to come in and see a specialist such as yourself?
Yeah, the classic sign is pain after getting out of bed in the morning. And so
Mm,
that is a classic sign of plantar fasciitis and sometimes can also be associated with Achilles tendonitis. But I oftentimes ask my patients, well, when you first get out of bed in the morning, what does it feel like? And for those patients with plantar fasciitis, they immediately know, oh no, that's a horrible time of the day for me. It takes me about 5 or 6 steps before I can get going, and
mm,
those first couple steps feel like someone stabbing me with a knife, or different ways that the patients might describe that. But that suggests that those tissues of your plantar fascia are tight while you're not on your feet, and then when you go to step down, you're stretching a cold rubber band. And that inflammation that happens is a warning sign that your body is saying, hey, we're not happy, we're uncomfortable, and being off of your feet allows things to contract. And so I recommend patients doing the towel stretch in the morning before they get out of bed, and that helps with those type of things. But generally speaking, anytime you're experiencing pain,
mm.
that's your body's clue to tell you that something is not right. If you find yourself walking differently to avoid one part of your foot or the other to kind of compensate for pain that you're experiencing, that's a warning sign that says that you should get in, get evaluated, and find out what's going on.
As far as continuing any type of workout routine, are there, I guess, any situations where a person can continue to work out while still having a minor injury?
Yes, patients can continue to work out. I oftentimes have young athletes that are in the middle of a season when their injury happens, and of course, the worst part of my job sometimes is having to tell a student
Mm,
athlete that, hey, I'm sorry, you should not be going back out to play, or you need to sit out. But ultimately, it's a decision between the parent, the student, and the coaching staff on whether or not they continue to play. Sometimes they end up deciding, well, I'm just going to put on a brace, or I'm just going to protect that area, knowing what it is, and kind of tough it out and get through the season. But yes, inevitably, there's a risk that comes with that because your tissues, the anatomy, the joint, whatever it may be, is giving off a warning sign with that pain. And that's our body's way of alerting us to the fact that there's something wrong. When our bodies become swollen and inflamed, that's our body's way of physically limiting the motion of that part of the body so that it is not moving and is not doing as much as it normally would. So oftentimes it's a matter of communicating with the patient that yes, you can go back to doing upper body exercises or seated, exercises at the gym, and avoiding leg press and lunges and squats and things like that that might be more demanding. And so it's always a conversation to kind of negotiate what is appropriate, what is still safe to do while still keeping people active, while still keeping them, relatively engaged with the sport of their choice.
Going back to what you said about plantar fasciitis being one of the most common injuries that you see, for a person that may be dealing with that on a continual basis, is there a way for them to, I guess, narrow down what may be causing that? Is there strategy that you would suggest for a person to identify what's causing that reoccurrence of that injury?
It might be difficult to narrow it down independently. Like we said before, it might be weight related, it might be shoe related, it might be activity related.
Okay.
Feeling a sharp, painful sensation on the bottom of the heel more
Mm,
so than on the back of the heel overwhelmingly, most of the time, is plantar fasciitis. But I caution patients on kind of making that diagnosis themselves because oftentimes patients will come in saying that, hey, I've had plantar fasciitis for X amount of months. I've had this treatment and that treatment. Things aren't getting better. What's going on? And we order an MRI, and an MRI is able to find out that there's a separate problem that's not even plantar fasciitis. And
Wow.
so a lot of the treatment might have been directed at plantar fasciitis, whether it was injections or whether it was, different things. And if those aren't working, then that's when it's time to see a medical professional and get a better diagnosis, because we underappreciate the complex anatomy that's involved in the foot and ankle. There's nerves, there's ligaments, there's tendons, there's muscles, all in a very small anatomic area. And
Mm.
so it's okay to somewhat kind of be aware. And of course, everyone loves Dr. Google, and people have a real concrete idea of what is going wrong before they even walk in.
Yeah.
But there has to be a little flexibility to that to appreciate that there's some nuance to finding out exactly what the problem may be.
I gotta imagine that you get a lot of people coming in as experts before they even talk to you from Googling things.
Yeah,
That
yeah,
has to be a big issue.
and yeah, I take it all in stride because
Yeah.
the benefit is that patients are aware and they're
Mm,
engaged and they want to be informed. And I
right.
spend a lot of time in my clinic really just educating patients on what's going on, aside from administering the actual treatment, but just
Mm.
letting them, understand what the anatomy is, what's going on, and then helping them be more informed so that they can go out and do the things they like to do.
And if a person need to find a podiatrist, what is a good place or a good resource for a person to find a qualified specialist such as you?
So a couple of ways to find a podiatrist in your area. The American Podiatric Medical Association is the parent company of podiatry in the United States. And so going on their website, you can find a podiatrist in your local area. And then depending on a patient's situation, through their insurance company, oftentimes we'll have a list of podiatrists in the area that are covered by their insurance plans to be able to find someone that is in network and accepting new patients.
Well, Dr. Graham, I appreciate the conversation today. I think it was very informative and I learned a lot. Thanks for coming on the show and good luck in all you do.
Well, thank you. I appreciate it. And I'm on social media. I also have a website, grahamdpm.com. And so if anyone wants to reach out to me, has any additional questions, feel free.
Thanks again to Dr. Graham for today's discussion. You can follow Dr. Graham on Instagram at GrahamDPM. Again, that's at Graham, GRAHAM .DPM on Instagram. Or if you have any questions, you can also visit his website at Graham, that's GRAHAMDPM.com. Don't want to miss any episodes in the future? Go to YouTube, iTunes, Spotify, or anywhere you get your podcasts. Search for the RVA Running Man podcast and subscribe. I appreciate the support of every last one of you. Until next week, please be safe on the roads and trails. I'll talk to you later, runners. Peace.